You've probably been told to ice your injuries your entire life. But what if I told you icing might actually be slowing your recovery? If you're a runner dealing with knee pain, Achilles pain, or shin splints, this could be the reason you're not getting better. In this video, I'm going to walk you through what to do instead. I'm Dr. Peralta, a physical therapist and run coach. And over the past 10 years, a pattern I've seen a lot of runners who keeps getting stuck in pain is that they reach for the ice pack every time something hurts, right? They just become dependent on the ice pack. They think that inflammation is bad and needs to be reduced immediately, right? They're relying on the ice, thinking, okay, if I just ice and rest, the pain will just magically go away. I just have to keep icing and resting, icing and resting. The problem is when you do this, you're not actually fixing the root cause. This creates a cycle where you get pain, you start hurting somewhere, you get the ice, you get some temporary relief. Sure, ice is an analgesic, it will numb the pain, but then the pain comes right back. And then you start developing these weakened areas, like a weakened tendon. Maybe your Achilles tendon's weak, and maybe your quad tendon's weak, or maybe even your plantar fasciitis. It never fully is resolved because you keep reaching for this passive modality with the ice and then resting, and you try to pick up running again, and then the mileage ramps up, and then boom, you get injured again, right? And then maybe something else hurts, and you keep thinking, oh, I'm just gonna keep resting and icing and hoping and praying, and that pain is just gonna go away. And if you want to copy this Google Doc to learn how to fix your running pain step by step, put together my system inside my free run group, click the link in the description to grab a copy. So what I teach instead is that stop treating inflammation like the enemy. Inflammation is part of the natural healing process. It takes place in the first week after an injury, right? Typically in the first 24 hours, but it can last a whole week or so in a normal type of injury. Let's say you sprained your ankle. Your body sends blood flow and repair cells to the injured area. And shutting that down too early can delay recovery, right? So here's the stages of wound healing. You see the graph here, and the inflammatory phase in the first 0 to 7 days or so. In this figure, I know it says 6 days, but anyhow, and then you could go into the repair phase. Some people call this proliferation. The repair phase is about the next 21 days or so, or it can even go up to, so about 3 weeks or so. And then remodeling, we're looking at 6 weeks or even longer. Remodeling could take, depending on the type of injury, remodeling could be 3 months, 6 months, a year, 2 years. It depends on the type of it. But most type of running injuries will typically repair or remodel, go through these phases within like 8 to 12 weeks or so, even 6 weeks. It really depends on the type of injury, if it's minor versus a more severe injury. That being said, the inflammatory phase, the very first phase of the healing, is very important. If you delay it by over-icing it, well, all you do is prolong the healing process or make it skip a step, and then when the body skips the step, it's going to not have the right healing. There's like micro factors that go in there, macrophages that goes clean up the dead tissue or whatever, or the injured tissue to eat it up. And so now you can have this weakened tissue that's kind of hanging around in the body, and this weakened tissue can then obviously be predisposed to injury. It's like you never got a complete repair. So understand when ice actually makes sense. Yes, you can use ice for acute injuries, like a rolled ankle, right? You have immediate swelling, but it shouldn't be used for more than the first 1 or 2 days, maybe up to 3 days tops, right? 72 hours. And you shouldn't be icing for hours nonstop, like just 10 minutes, 10 to 15 minutes, with like about a 30-minute gap if you need it, or even just maybe 2 or 3 sessions per day. I mean, you shouldn't be icing the entire day, but I get it. If the first day you're in a lot of pain, like maybe take a gap for like 30 minutes, 30 to 60 minutes, and then you could ice again for another 10 or 15 minutes or so for the first 1 to 2 or 3 days there. But it's not a long-term strategy for chronic injuries. Right? If you keep having this recurring pain week after week, you shouldn't be relying on ice to for pain relief, or like, oh, I'm going to try to get rid of this excessive pain inflammation week after week. Like, you have to kind of stop and ask yourself, why is this injury taking so long to heal? What's causing it to be re-triggered? Right? Focus on blood flow, not shutdown, right? So instead, I tell people, even with acute injuries or even severe injuries, focus on movement, right? Gentle movement. I'm not saying go run a marathon. No, that's not going to make any sense if you can't even walk because you're limping. But gentle movement, maybe pumping your ankle, maybe going on a bike or a gentle walk. Movement increases circulation and healing. Light activity is better than complete rest, right? Don't just lay on bed all day with an ice pack on your ankle. No, it's better to go out for a gentle walk. And then you could do heat as well, and mobility, right? Again, general movement, right? Again, if we're talking about the ankle, just pumping the ankle can support recovery better than just, trying to put it on ice all day. So fix the root cause. This is where most runners fail. The root cause could be your training errors, right? Too much mileage, too much too soon. too fast, right? So, look at your volume, your miles. Like, hey, did you ramp up mileage too much? Are you doing a plan that's outside your ability levels? Look at your form, right? Maybe are you overshredding? Maybe you lack hip extension, because these form issues can cause these injuries to persist. Or maybe you have like weak tissues in your body, right? Running's a high impact sport. Make sure you're doing the proper strength training to strengthen your glutes, your calves, your feet, so your body can handle the demands of running, right? So ice doesn't fix any of these, right? So if you think that, oh, I'm just going to ice it, again, it's just masking. It's like putting a Band-Aid on the problem. It's going to, yes, it'll give you some temporary pain relief, but it shouldn't be used long term. It's better to address these root causes and to stop the injury, prevent the injury from happening in the first place. So use load to heal, not avoid it. Tendons and tissues need progressive loading to adapt. Loading means essentially strengthening. And it can come from different things: body weight, machines, free weights, etc. And there's gradual ways to load it. You can start with body weight and progress from there. Like we're talking about the, let's say, ankle, Achilles tendon. You can start with body weight calf raises and then add some load, some weight to that calf raise to progress it. Or go from 2 legs to 1 leg, for example. Complete rest often makes things worse. Smart strength training builds resilience. So be careful with overusing ice and anti-inflammatories. So there's the same problem with taking NSAIDs like ibuprofen, right? Ice and meds can reduce symptoms but may slow adaptation. If your goal is performance and long-term healing, this matters, right? So stop trying to, put the Band-Aid solution with the ice or taking the anti-inflammatory meds. So what happens when you do this right? Pain actually starts to resolve instead of coming back. You build stronger, more resilient tissues. You stop relying on temporary fixes. Running starts to feel smoother and more efficient. So you can train consistently without constant setbacks. If you want help applying this to your specific injury, I'm offering a free consult call to discuss private one-to-one coaching. Book a call with me, link in the description. So the real lesson, ice isn't bad, it's just overused and misunderstood. If you're dealing with long-term running injury, icing alone won't fix it. Your body doesn't need to be shut down, it needs to be rebuilt.